Hi, everybody. This week I was saddened to hear about the death of Dr. Susan Moore, the medical doctor who caught COVID and received really poor treatment at the Indiana hospital where she was initially sought treatment. And she documented her experiences with Dr. Eric Bannock, as well as other members of her care team who didn't take her symptoms seriously, who challenged her on her own assertions about her body and her symptoms, and who overall treated her like she was a drug addict rather than an actual patient who needed good care. So we know that living in the United States, that many of our institutions, almost all of our institutions, are influenced by white supremacy, and that is true for the medical professions and for hospitals and the other institutions that are affiliated with healthcare in the United States. So being a black person in the United States who's had my own share of medical malpractice, trauma, and other issues, I think it's important to recognize that we have tools under our belt that we should be able to use when necessary. So thank God Dr. Brown was able to record herself and her interactions or her perceptions of her interactions with her health professionals. So what I recommend for all of us to do, but especially if you're black in the United States, is to record your interactions with your health professionals. And that could mean, using a video camera, right? Using your phone, the video option on your phone. Or it can mean something as simple as voice memos. And you can let the people know, hey, I'm recording all of this so that I can have a record of my interactions with my care team. Because it's important for me to know what you guys are suggesting. It's important for me to know and understand my different options. So see it as a tool for yourself to keep track of all the different things that doctors and nurses and other care professionals are telling you, but also keep it as, insurance for just in case. If in case these doctors or nurses or whomever treats you inappropriately. So there is a record. And we know that in the United States, no matter what happens, we love to blame victims. And that's true for victims of white supremacy and anti-black racism. We love blaming African Americans for being victims of white supremacy. At the same time, we do have our own tools, and we are a part of a larger movement, right? We are a part of a larger movement for Black lives. And so make your life matter. When you're talking to doctors, whether you're just having a regular checkup, whether you're in the hospital, or other things are happening in your life that require medical attention, record your interactions. Just let them know, hey, this is for me. Maybe they'll treat you better, maybe they won't, but at least there will be a record of it.